Hey, I'm blood. I'm going towards the kidney. Ha ha ha, blood is coming. I'm going to filtrate him and do my function, that is urine formation. So, you didn't understand till now? Our today's topic is renal circulation and urine formation.
So, our today's topic from renal physiology is renal circulation. Blood vessels of the kidney are highly specialized to facilitate the function of nephron in urine formation. Renal arteries supplies the blood to the kidney. So, kidney receives 300 ml of blood per minute. That is 26% of cardiac output. Now we will study the flow of the blood through the arteries and vein. That is renal artery and vein. What happens from the abdominal aorta, renal artery arises, which gives the segmental artery and which divides into interlobar artery. Then after this interlobar artery, the blood travels through the arcuate artery. And after arcuate artery, the blood travels through interlobar artery, then efferent arteriole, then glomerular capillary, then efferent arteriole, and after which blood passes through vasa recta of juxtamedullary nephron, capillaries of the cortical nephron. Then after reabsorption and tubular secretion, blood goes into the peritubular vein, and after that it goes into interlobar vein, arcuate vein, then interlobar vein, segmental vein, renal vein, and finally the blood goes into inferior vena cava. This is a diagram representing interlobar artery, then after which blood goes into efferent arteriole, then glomerulus, then efferent arteriole, after which either blood goes into peritubular capillary or vasa recta, and then it goes into vein. First peritubular vein, then interlobar vein, then arcuate vein, then interlobar vein, then segmental vein, and then renal vein, and finally into inferior vena cava. Now, regulation of renal blood flow or renal autoregulation. Why it is called as renal autoregulation? Because our organ kidney have an intrinsic ability to regulate its own blood. Therefore, it is called as renal autoregulation. Kidney does this by two mechanisms. First is myogenic response and second is tubuloglomerular feedback. In myogenic response, blood flow into the kidney, due to which the wall of the arteriole gets stretched and the influx of calcium ion from extracellular fluid to the cell occurs, due to which there is contraction of smooth muscle of the arteriole, and this leads to decreased blood flow. So, how kidney regulates the blood via myogenic response? पहले क्या होगा, ब्लड फ्लो जब किडनी में बढ़ेगा तो आर्टेरियल वॉल का स्ट्रेचिंग होगा. क्यों? उसके बाद क्या होगा? उसके बाद कैल्शियम आयन का एक्स्ट्रासेलुलर फ्लूइड से सेल के अंदर इनफ्लक्स होगा, जिसकी वजह से स्मूथ मसल का कॉन्ट्रैक्शन होगा, आर्टेरियल की स्मूथ मसल का कॉन्ट्रैक्शन होगा और ब्लड फ्लो डिक्रीज करेगा. दिस इज वेरी इंपॉर्टेंट. एंड देन we are going to study tubuloglomerular feedback. According to this feedback, if there is increase in GFR, this will lead to increase in NaCl concentration in tubule, and after which the macula densa gets stimulated and it secretes adenosine and thromboxane A2 hormone. And due to the release of thromboxane and adenosine, contraction of efferent arteriole takes place. This leads to decrease in glomerular blood flow, and then this tubular glomerular feedback leads to decrease in GFR. Okay. So these are the two mechanisms like how kidney regulate the renal blood flow.